So I'd like to now introduce Dr. Charles Stuckey. Dr. Charles Stuckey is the Executive Director of the Pennsylvania Optometric Association in Harrisburg, Pennsylvania. The Pennsylvania Optometric Association is the professional organization for over 1,250 doctors of optometry in Pennsylvania. He is testifying on behalf of the American Optometric Association. The AOA represents 36,000 doctors, students, assistants, and technicians in the optometry industry. Welcome, Dr. Stuckey.
Thank you, and good morning. My name is Charlie Stuckey. I practiced as an optometrist for 23 years in Pennsylvania, and I am currently the Executive Director of the Pennsylvania Optometric Association, representing more than 1,250 Pennsylvania doctors of optometry. Today, it is my honor to testify on behalf of the American Optometric Association and its 36,000 members nationwide, many of whom have traveled to Washington, D.C. today to participate in the AOA Congressional Advocacy Conference. We appreciate this opportunity to provide the House Small Business Subcommittee on Regulation, Healthcare, and Trade with our views and recommendations regarding the challenges to greater adoption and use of health information technology facing physicians, specifically doctors of optometry, and other healthcare providers. The AOA agrees with many analysts and policymakers that health IT is an important ingredient for improving the efficiency and quality of healthcare in the United States. The electronic health record, or EHR, is the central component of health IT, and when used effectively, can enable providers to better organize patient data, replace lengthy record processes, help deliver better coordinated care among a patient's team of healthcare providers, prevent errors, and cut overall healthcare costs. The AOA was pleased that optometrists were included when Congress incorporated a provision within the American Recovery and Reinvestment Act of 2009, or ARA, to spur greater adoption of health information technology by providing substantial financial incentives to help physicians purchase and implement health IT. AOA members appreciate and value the opportunity to obtain this unprecedented assistance. However, significant barriers to widespread adoption and use remain. ARA explicitly states that for a physician to be a meaningful user of health IT and be eligible for incentives, the EHR that he or she uses must be certified. Yet to date, the only federally recognized certification body is the Certification Commission for Healthcare Information and Technology, CCHIT, which has not developed a certification for eye care EHRs. While AOA concerns focus mostly on eye care, we believe that our situation will not be unique, as other medical specialties with specialized EHR systems seek to develop certification through CCHIT. The AOA and others lobbied for a path to certification, which led CCHIT to place eye care on the roadmap for a 2011 launch. We continue to argue that it was essential for the eye care specialty to have an accelerated timeline for launch so that eye care professionals would be able to adopt certified EHRs and be able to use them meaningfully by 2011. We were delighted to learn earlier this month that the Commission is open to an eye care EHR certification launch in 2010, but the limiting factor to add specialty areas of certification was resources. Today, the AOA would strongly recommend that the Office of National Coordinator endorse and support the expansion of specialty areas of CCHIT certification to ensure ARA incentives to serve their intended purpose of spurring widespread adoption of health IT. In addition, we would urge that as policymakers and certifying organizations move to define meaningful use, we would caution against a one-size-fits-all approach. Just as different providers need different types of EHRs, the meaningful use of EHRs can vary. The bottom line should be improved results for patients. In addition to certification concerns, the AOA is troubled that some provider colleagues are not currently eligible for HIT adoption incentives and may be left behind as a nationwide HIT network develops. While ARA provides incentives to doctors of optometry and other Medicare physicians, the legislation does not address the need to ensure the inclusion of a large and diverse group of providers which comprise a significant part of our healthcare delivery system. AOA fosters a multidisciplinary team approach to care. The AOA urges the committee and leaders in Congress to ensure that all clinicians are included as we get to work on developing a nationwide health IT network. This is particularly important for optometrists and other clinicians who are small businesses and need to be able to plug into local and regional networks. Thank you for the opportunity to represent the concerns of thousands of owners of small business optometric practices before you today.